Hello, and thank you for joining us today. Please take a moment to say hi in the live chat and let us know where you're joining us from. I see Pat has joined us today. Hi, Pat. It's great to see you. We welcome all comments in the live chat. My name is Stephanie Paul, and I am the Executive Director of myFace. I am so excited to welcome you all to our program today, designed for families of children with craniofacial differences, as well as for their caregivers and healthcare providers. I would like to thank the Milbank Foundation for funding this important program and acknowledge their appreciation for the critical need to provide educational programs like this one for families of children impacted by craniofacial differences. Before we bring on today's guest, I want to take a moment to talk about myFace. myFace advocates for a holistic, comprehensive team approach to care through the wide range of programs we fund, including support of the world-renowned myFace Center for Craniofacial Care at NYU Langone Health in New York City, which serves as the gold standard for craniofacial care. In addition, myFace provides important direct services such as access to individual and family support groups, topic-driven workshops, informational webinars, and network opportunities. We also provide travel assistance and housing for out-of-town families, as well as providing access to educational resources and raising public awareness. myFace is here to bring the craniofacial community together and help transform the lives of children and adults living with facial differences. We believe everyone deserves the chance to thrive and live the best life possible. Now I'm thrilled to introduce today's guest speaker, Matt Mortier, Director of Consumer Services Life and Health Section at the Division of Insurance for the Colorado Department of Regulatory Agencies. Matt is here to provide some tips and advice for navigating health insurance, as well as giving an overview of the nuances of health insurance for members of the craniofacial community. After Matt's presentation, we will be joined by a myFace family to share their personal perspective on navigating insurance, and we'll be taking questions from you. So at any time during the program, you can enter your questions into the live chat, and we will do our best to answer as many questions as we can. After the program, look out for an email with a survey about today's presentation. Please take a few minutes to complete this survey. Your feedback is so important as we develop future educational programs for the myFace community. If you'd like to download a printable version of the slides from today's program, please visit us at myface.org/transforminglives. That's myface.org/transforminglives. Thank you for being here and for being a part of the myFace community. And now, let's please welcome Matt Mortier to the broadcast. Hi, Matt.
Hey, Stephanie. Thank you very much for having me. It's a pleasure to be here, and I'm looking forward to sharing with your community and your folks information about how things are done in Colorado, some overviews about health insurance, and overviews as to how it interacts with those with craniofacial differences. So with that, let's get started with the presentation. As Stephanie said, feel free to put questions in the chat, and we'll have a Q&A session at the end. So please follow along, take notes, and here we go. All right, so I'd like to give a quick overview of the topics that we're going to cover today. I'm going to give an overview of the health insurance market, kind of the three different segments that are involved. I'm going to talk a little bit about some general ideas of what to know when you choose health insurance, with, of course, a focus on reading the fine print. I'm going to talk a little bit about some of the most commonly used insurance terms out there, deductibles, copayments, coinsurance, things like that, and talk about them a little bit and help give a little more in-depth description of what they all mean and how they interact in your policy. I'm also going to talk about in-network versus out-of-network benefits. This is a very important thing when families are looking to get care for their children. It's something that needs to be addressed, and I want to give some advice about how to find and work with in-network, and if you actually have to go out of network, how you can see if your insurance company will cover it. Another topic we'll briefly touch on is working with state insurance regulators. Every state out there has a division or department of insurance, such as the one I work at in Colorado. They are a resource. They exist to help consumers just like you. And our days are spent trying to support the consumers and citizens of our states, answer questions, the difficult questions about insurance. And then last but not least, want to talk about how you obtain approvals and dealing with denials for care and how to go about appealing those denials for care. All right, it's a lot to cover. I'll do my best. And if anything is left out, again, questions at the end would be great. A quick overview of the health insurance market in the United States. We say we kind of, at least in Colorado, divide it into thirds. 1/3 of the population is covered under federal health programs, such as Medicare, Medicaid, and TRICARE, which is a military insurance program. Another third of the market is made up of self-insured health plans. These are also known as large group plans, or ERISA. ERISA is the acronym for plans regulated by the Department of Labor. Those are the employer plans, the large employers, and they're subject to federal regulation, not state regulation. And then the last third of the market is the fully insured health plans out there, the Affordable Care Act compliant, individual and small group market. Plus, there are some large group market plans. Some large employers decide to purchase insurance outright rather than manage it themselves. So a small portion fall into that kind of third bucket in the insurance marketplace. If you have insurance through your employer, most likely it's going to be a self-insured plan and regulated at the federal level. But the states have been delegated the authority to regulate insurance in their own states that are sold in their own states on the individual and small group market. Colorado, I'll be using throughout this presentation as an example because that's where I live, that's where I work, that's what I know best. But again, it varies state by state. But overall, the topics I'll be talking about carry over from state to state and also kind of across at least the self-insured and the fully insured market. All right. Next, what you need to know in choosing health insurance. I know this is a big question. Insurance can be complicated. But again, your division or department in your state is an excellent resource. We're there to answer questions and help however we can. But when you are looking at health insurance, the main things you really want to look at are determine if you're eligible for federal tax credits through your state exchange, or if you live in a state that has a federal exchange, you would go through that platform, that website to determine. Usually it's based off of your income. Under the Affordable Care Act, it set caps for how much of your income as a percentage you need to pay towards insurance. And if the insurance costs more than that, it is made up by federal tax credits. Similarly, if you enroll through one of the state exchanges or the federal exchange, you'll be putting in income information that will actually allow the system to calculate whether you qualify. It can be to the point where if you qualify for enough tax credits, your insurance can almost be completely paid for, or in some instances, actually fully paid for by the tax credits. And then you can decide how you want to receive those credits, either monthly or on your tax return at the end of the year. You also want to be sure that you shop for a plan based on your healthcare needs and costs. Again, the insurance market has gold plans, silver plans, bronze plans. Depending on the metal tier, determines how much of the cost of healthcare is borne by the health insurance company. If you have a lot of healthcare needs, if there's some chronic conditions that require care, it may actually save you money in the long run to get what's known as a richer benefit plan. Instead of having a silver plan, maybe move up to a gold. Depending on the care you need, it might actually make financial sense to pay extra premium for the extra benefit. So again, something that each family has to decide kind of on an individual basis, but it is something definitely you want to look at. We also want to stress that it's important to look at provider networks closely. Networks change all the time. All carriers have to have sufficient networks to cover all the benefits they offer in a timely fashion and within a reasonable distance. And those are contract decisions made by the carriers, made by the doctors. So provider groups move in and out, specialists move in and out. So always look and check and see if there's a particular provider that you're working with, make sure you check the networks to see if they're in it in the plans you're looking at. You may actually have to switch plans from year to year to a different insurance company if your doctor moves to a different plans network. And just so you know, they can be in more than one plan's network at the same time. It's not exclusive. If you take specific medications, you definitely want to check the formularies to see what your cost sharing will be. In Colorado, we have a 4-tier structure where generics are on the lowest tier and name brand are at the highest, the high cost name brands. If you have specific maintenance medications or chronic condition medications that are needed, you may want to take a look and make sure that the plans you're looking at have those in the formulary and are covered, and to see what percentage of the cost you'll be required to bear, if it's before deductible or after deductible. But again, I'll get into some of those details later. And then also under the ACA, it mandates that all plans, at least all people who enroll in ACA compliant individual plans, have some sort of pediatric dental coverage. You can decide if you want that to be provided through a standalone dental plan, so you can buy dental insurance separately through a dental carrier, or you can also shop around to find a health benefit plan that has dental benefits included. But one thing to remember, if that happens, if you have a medical plan with dental benefits, your deductible, that amount of money you have to pay out of pocket each year before your insurance plan starts covering benefits, if the dental plan is in there, you have to meet that deductible for the whole plan before your dental benefits are covered by the insurance company. So a lot of people choose to go with a standalone, but depending on your needs, maybe one that has a dental plan embedded in your medical plan is a good choice. So what also needs to be considered when you're choosing health insurance, and kind of what I was talking about, is a cheaper monthly premium can often be offset by higher healthcare costs. We know a lot of consumers purchase health insurance based off of premium. We understand. Insurance can be expensive. It can take up a big chunk of the monthly budget. But one thing that we always encourage consumers in Colorado to look at is that cheaper premium actually worth it if you have higher healthcare costs? Again, like I said earlier, in the Affordable Care Act, there are several different metal tiers that provide richer and richer benefits. A gold plan may cover 80% of your costs after you meet your deductible, whereas a bronze plan might only cover 65%. So if you think about any major procedures or surgeries that need, or care that might be needed, it might actually make more sense to pay that extra $200 a month in premium to get a richer plan, if it means you're going to be paying several $1,000s through the year less in healthcare costs. So be sure to take a hard look at that, especially if you know some procedures are coming up. You also want to find a plan with a deductible and co-payment coinsurance structure that's good for you and your family. Again, there are plans out there that are known as high deductible health plans. Those tend to have deductibles in the $4,000, $5,000, $6,000, $7,000 that need to be met before insurance company benefits kick in. But you could also pay more for a plan that, instead of has a high deductible, you have a higher copayment, or you pay a greater percent of the cost of the care to offset some premiums. So again, see what a good mix is, see what the premiums are, but also see what you're going to have to pay out in deductible throughout the year. You also want to take a look at what kind of plan you're getting. Under the Affordable Care Act, there are mandated benefits that need to be covered. They're known as essential health benefits. There are other products out there that are not ACA compliant products, known as limited benefit plans, some short-term limited duration health insurances. You need to take a really good look at those and look at the fine print, because they are a good fit for some people. They are not often a good substitute for major medical coverage or ACA compliant coverage. A lot of the plans that we've seen that come across my desk when we have complaints involve consumers who thought they purchased medical coverage that would cover most things, but the fine print of the policy doesn't cover emergency room visits, or it doesn't cover pregnancy, or it doesn't cover anything other than a couple of doctor's visits a year and certain types of drugs. So again, you need to read the fine print. And an adage, that last bullet on the slide, is an adage we use a lot. If it's too good to be true, if it's cheaper than you think it should be, it probably is for a reason. It probably is too good to be true. So again, read the fine print, make sure you know what the plans you're looking at cover and what they don't. And again, if you have any questions at all, please reach out to your state's division or departments of insurance. And that's what they're there to do. They're there to help. They're there to look at those plans, talk you through them, and help answer your questions. We don't recommend any plans to anyone, but we can answer your questions for sure and help you make your decisions. All right, this next section, I'm going to get a little bit weedy, so I apologize, but insurance is full of a lot of jargon. There's a lot of terminology and specific words that we never use in any other part of our lives that come up in insurance. So I thought I would talk about those a little bit and give a little bit of give some examples and kind of talk through those, because again, as I'm giving my presentation, I'm using these words. So I thought it would be helpful to step back a little bit and talk through some of them if people aren't familiar. So I'm going to talk about deductibles, copay, coinsurance, and some other terms. So the first one that you hear me using a lot is deductible. A deductible is the amount of money you have to pay before the insurance company will pay a claim. For each of these slides, I'm going to give some examples in there. I may not talk all the way through them to save time, but again, if questions are needed at the end, feel free to ask. I'll try to keep this fairly high level. But a deductible is the amount of money you need to pay in allowed charges before they'll begin to apply your coinsurance. If you have an 80% coinsurance, that means you're going to be liable for 20% of the charges after you meet your deductible. So if you have a $3,500 annual deductible, you have to pay $3,500 in allowed charges. The key thing there is allowed charges. Certain things may or may not be covered depending on if they're in network or out of network, but that's the amount you have to meet before the insurance company will start paying a portion of your care. Some plans have separate deductibles for certain services like prescription drugs. Again, if you have a chronic condition or you are wanting to deal with some long-term health issues, again, it's important to take a look at that and see if maybe that kind of a plan would work best for you. Family plans where you have your children on your plan or your spouse or other dependents, they have both an individual deductible and a family deductible. The individual deductible is for one person. If more than one person has received care during the year, that will apply to the family deductible, which is often higher. And then your medical deductible, as I said earlier, applies to dental benefits if the dental plan is embedded. So let's talk about some more terms. When I said allowed amount, again, these have to be eligible expenses or the negotiated rate that the provider has contracted to use. We'll get more into what an in-network provider versus an out-of-network provider is, but the eligible expenses are what's counted towards your allowed amount. For example, a provider may bill $1,000 for a procedure, but their contract with that provider will pay for $500. So on the explanation of benefits form you'll get from your insurance company, it'll show that $500 was the allowed amount, and that $500 would then be applied to your deductible for the year. A copayment is a fixed amount you pay. For example, when you go to your doctor's visit for your annual checkup, you may have a copay of $200. The allowable cost is $100. They'll cover the other $80 on that because you've met your copay. Also, I should note that under the Affordable Care Act, a lot of preventive care is covered at no cost. So if you have an Affordable Care Act compliant plan, those annual visits for the most part should be completely covered. If you haven't paid your deductible, you're going to pay 20% at the time of visit. If you've paid it, if you haven't met it, you pay the full 100, and that'll go towards your amount for the year, towards your deductible for the year. I do want to bring up again, certain preventive services and screenings are covered at no cost. There is a website that I put into the slide you can go take a look at, but it has a long list of the preventive care benefits, at least in Colorado, that all have to be covered, and in most states as well, including things such as blood pressure screening, diabetes screening, certain parts of pregnancy care, things like that. So I would encourage anyone to go take a look at those and see what services are covered at no cost share. So coinsurance is the percent you pay, the healthcare services that you pay after you've met your deductible. Like I said in my example earlier, if you've met your deductible and you have an 80% coinsurance, you're only going to pay 20% of the cost. So here, again, if the allowable costs are $12,000, the deductible is $3,000, your coinsurance is 20%, your out-of-pocket max, that's an example of a plan you have. I'll try not to repeat everything on here, but after you meet your deductible, you're only going to pay 20% of the remaining allowable costs. So once you've met that deductible, your liability as a percentage of the charges goes way down. But again, it's something that you have to meet each year. It resets every year on the anniversary date. So on January 1, your deductible resets. So again, keep an eye on that throughout the year. All the documents you get from your insurance company should have that, and it provides very important information. So keep those in a safe place. So another important term to use is out-of-pocket maximum. Under the Affordable Care Act, there is what's known as the annual out-of-pocket maximum. This is the most you have to pay for covered services in a plan year. If you've met your deductible and you keep getting care, you keep paying your, say, 20% or 30% of your coinsurance, once you reach that out-of-pocket maximum, your healthcare costs are covered at 100%. So again, a lot of times, depending on the plan, this can be $8,000, $10,000. The federal government changes it every year, bumps it up a little bit due to inflation. But once you meet your out-of-pocket maximum, which should be in your plan documents very clearly, any covered services, again, services that are offered by contracted providers that are covered by your plan, the health insurance company will pay 100% of the cost of those. But the out-of-pocket doesn't include your premiums. Those don't count towards deductible or your out-of-pocket max. Anything that your plan doesn't cover, any out-of-network care and services if you don't have any out-of-network benefits, and any costs above the allowed amount that a service provider may charge. And we'll get into that more when we talk about networks. And that's a great segue into in-network and out-of-network benefits. I did put these in order for a reason. All right, so in-network versus out-of-network. This is something that we deal with a lot out in Colorado, and wanted to talk about this a little bit in depth with you all. First and foremost, there's usually two main types of health insurance products out there that are compliant with the Affordable Care Act. One is an PPO plan. That stands for Preferred Provider Organization. That's if you have an employer plan, that's most likely what you might have. They have a broader network of providers, and they often have out-of-network benefits, but they do tend to have higher deductibles for out-of-network care. So your in-network deductible may be $2,000, but your out-of-network deductible might be $4,000. So you can use out-of-network providers, and they will be covered, but you have a higher deductible to meet each year. HMO, which again, a lot of you are familiar with, it stands for Health Maintenance Organization. Those plans do not usually have out-of-network benefits. You have a specific organization of providers that you need to see for your care. That tends to lower premiums a little bit, but it is a smaller, more narrow network than a PPO plan traditionally. If you have an HMO plan and do not find a provider who is in network for your care, and if you go out of network, you will likely be responsible for the full billed amount from your provider. Again, that's why in-network versus out-of-network, knowing that is very, very important. If you go out of network with an HMO plan, odds are the insurance company will not pay anything towards it. So again, always check with your carrier. They have websites, they have provider directories. So I would encourage you to go, and it has to be, at least in Colorado, on their main page. So you can log into your account, click on find a doctor, find a provider, put in what you're looking for, and it should be able to give you who in your area is in network for the care you're seeking. And also, when in doubt, call that insurance company, call your carrier, talk to customer service, and have them confirm whether someone's in or out of network before you seek care. It's definitely worth the protection it offers to double check and make sure before you go. And some states do have balanced billing protections for some out-of-network bills. I know in Colorado, if someone goes to an out-of-network provider for emergency care, our statutes hold them harmless and don't allow the provider to continue to bill them if it's an emergency care. If someone goes to the ER, they often don't have a say in where they go. So those protections were put in place by our legislature. So always check to see if the provider you're going to is in network and out of network. And as I said earlier, if you're shopping for a new plan or renewing from year to year, again, double check to see if the plan you're considering still has your providers in network for it. Because again, contracts can change, and it's something that is worth looking into if you have a particular provider that you want to use. All right, working with state insurance regulators, such as myself. As I said earlier, divisions of insurance and departments of insurance exist in all 50 states. We all work together to help regulate the insurance industry that we can all regulate at the state level. A big part of what we do is to protect and educate consumers. In Colorado, our tagline is consumer protection is our mission. That's what we're there for. That's why we come to work each day. Our job is and we enjoy our job very, very much. We love answering questions. We love digging into the details. We love explaining the complex in and outs of insurance when people need help. It is a complicated topic. So our job is to provide oversight and to educate consumers. A big part of what I do and the staff that I manage is to actually investigate those complaints. when consumers are having problems getting things covered that they believe should be covered by their plan, or if they filed an appeal and there were some issues having it approved in time or denied in time. Those are things that we encourage people to file with our state, with the Division of Insurance. And we look into those very deeply to make sure everything was done correctly, the insurance company acted appropriately, appropriate documentation and notice was provided, things like that. Again, all 50 states have sections that specifically focus on investigating complaints. So again, if you have any potential complaints or issues, contact your local division or Department of Insurance, and I'll be more than happy to help. We also regulate insurance companies and provide oversight, make sure they're complying with our state laws and to some extent federal laws as well. We want to make sure they have the appropriate notices when consumers are being terminated for non-payment of premium. We want to make sure that they provide the right information when someone is seeking an appeal. So there's a lot of things that we do to make sure that the insurance companies are complying with the protective laws in each of our states. And ultimately, we want to help consumers navigate the prior approval and appeals process, which I think is very important, especially for you all in the myFace community, because I think that's probably an area that you are all very familiar with. It can be complicated depending on whether you have an individual plan or a plan through your employer. Things may be a little different. I will be speaking throughout this presentation towards how things are handled in Colorado. But again, there will be similar structures in all of the states. And again, reach out to your insurance department or division if you have any questions. So one question we get a lot is my plan regulated by my state? In Colorado, the most important thing you need is your member ID card. I know mine's in my wallet over there. But the first thing to look at is check that member ID card. In the state of Colorado, we have to have there's this requirement that the card state very big font in the lower left-hand corner, CO-DOI. That means it's regulated by the state. If you purchased it on the exchange in your state or on the federal exchange as an individual plan, odds are it's regulated by your state. So that means we have regulatory authority over it. And as that bullet says, state insurance laws apply and we can help. We can still help if it's not a plan we regulate, but our options are a lot more limited to just giving advice and answering questions. There are similar requirements in other states. So again, check and see. If in doubt, you can call your insurance division or department and ask them to confirm that your plan is regulated by your state. But get to know and utilize your state insurance regulators. Our website is easy to access if you're in Colorado. It's doi.colorado.gov. And there's all sorts of resources on state insurance department websites, from regulations and bulletins to press releases to the complaint portals to file complaints. So check it out and see what information they have. And it definitely serves as a resource. Next slide, please. Oh, there we go. What can't the state insurance regulators help with? Again, we do only regulate plans issued or sold in our state that we regulate. So individual and group policies issued in other states, we don't have authority over it, but we can also refer people to those states, to those divisions and departments of insurance for assistance. Health plans that are self-funded by employers. Again, I said if it's a large group plan, if it's an ERISA plan, that means that the insurance company pays their own claims, and they often hire a third party to manage the process, or they do it all internally. That's what's called a self-funded plan. They bear the cost themselves. Those plans are regulated at the federal level, so that's who provides the oversight. Single employer plans, where the contract is issued in another state. I run across several of these recently where a consumer lives in Colorado, works in Colorado, but their employer is based out of California, and that's where their insurance policy is issued. So for those consumers, even though they live in Colorado and work in Colorado, because their employer is based in another state and purchased insurance for their employees in that state, that's the state that has oversight. So again, we would refer them back to the state in which the policy is situs or where it was sold. Medicare and Medicaid issues, again, have to go to the federal government for Medicare, and all states have their own Medicaid offices. In the state of Colorado, it's the Department of Healthcare Policy and Financing. If it's a Medicaid issue, we would send it over there. And then also federal employee benefit plans. If you're a federal employee or a former federal employee, that's all regulated at the federal level. All right, so we're getting into the prior approvals and appeals and denials section of this. All health benefit plans have some sort of prior approval process. At the state level, it's outlined in state statute and insurance regulations. And also, if you have a self-funded plan, take a look at your policy. There will be hopefully a very clearly identified section talking about getting prior approvals. All of these regulations specify timelines for approval and denial. How long after you submit a request does the insurance company have to get back to you? Things like that. It is always beneficial to work with your insurance company to get prior approval for a procedure. In Colorado, if you actually get prior approval in writing, again, in writing is very important. If you get something in writing within a certain number of days of your procedure, it has to be covered, at least in the state of Colorado. So work with your insurance company, see what needs to be submitted, see what kind of forms need to be filled out, and how you submit these requests for prior approval. Because if they do approve it, it most likely will be covered by your insurance company. In particularly hard cases or complex cases, we often recommend that consumers reach out to the insurance company and ask for a case manager or an assister to help them navigate their prior approval process. We've had a lot of good success reaching out to the insurance companies in our state with complex cases saying, hey, we have a really complex case coming up with multiple procedures being done over this coming year. Could we get a case manager assigned to this consumer to help them out? And oftentimes carriers are very willing to help out with that. And it often leads to better outcomes and usually a little bit less paperwork and a little bit less headache. So we always encourage that too. So in Colorado, the term adverse determination, in other states as well, is what we mean when we talk about a denial of a request for prior approval, or if you have a denial for a procedure that was done and you're asking to be paid, you filed a claim and the insurance company says no. So that is what's known as an adverse determination. In Colorado, once you receive an adverse determination, be it either before the procedure or after, that's what triggers your appeal rights. Individual plans have a first level appeal and then an independent external review process. Group plans have a first involuntary second level. Again, voluntary means you don't have to use it, but you can. And then independent external review processes. A first level appeal is conducted by the insurance company, but it has to be someone who's not involved with the case. It's kind of like a uninvolved third party at the insurance company has to review the documentation. A second level appeal voluntary involves a panel review usually for group plans. And then, and we'll talk about this more later, independent external reviews are when you send an appeal out after you've exhausted your internal appeal rights to an independent third party, not affiliated with any company, that there are organizations around the country that do this. And then they take a look at it completely independently and make a determination whether to uphold the denial or overturn the denial. And again, just so you know, the appeal process does not cost the consumer anything. It's part of, the premiums you pay. You have the right to these appeals. The external review is not anything you have to pay for either. Carriers are required by regulation and law to cover those costs. So feel free to use them when warranted. In Colorado, though, at least under our statutes, you can only appeal a denial for medical necessity for independent external review. If it's appealing whether or not a doctor should or should not be in your network, that's not able to be sent out for external review. But if the insurance company says we're denying coverage for that service because it's not medically necessary, that is able to be sent out for independent external review. Again, expedited and non-expedited processes are there. Depends on the medical situation in statute and reg. And again, I would recommend reaching out to your division or department of insurance to talk through this. There are certain criteria that have to be met in order for it to be expedited. Appeals can also be filed on behalf of the policyholder by your provider. So we always encourage you to work closely with your healthcare providers when you're going through the appeals process, because they're the ones who will help make the case for something being medically necessary if it was originally denied as not medically necessary. Providers are often much more familiar with the appeals process because they've worked with multiple patients going through that. So again, utilize them as a resource. Again, divisions of insurance can give tips and departments can give tips as to what documents should be involved to make a strong case. But ultimately, providers need to submit sufficient documentation to show that either the procedure that is being contemplated is medically necessary or the procedure that was conducted was medically necessary. And that includes literature, articles, studies, medical records, and things like that. They're much more successful if a compelling case can be made. We can't stress that enough. Just sending a bunch of documents isn't as likely to be successful as making a compelling case from your provider and other treating providers that something is medically necessary. Again, the regulators are a resource. We can help you navigate the process, and they can also ensure that the carrier is complying with all of the notification requirements. If someone didn't get the proper notification, we can ask the carrier to start over the appeals process. So those things are set out in regulation and statute. So again, involve your insurance company if you need, or involve your insurance regulators if need be, and use them as a resource throughout this. But one thing that's important to know, if it does go to independent external review, that is binding. So if the denial by the carrier is upheld, you will be liable for the cost of the procedure if it has already been done, or the carrier will not cover it if you do decide to move forward with something if it is denied. It is binding on both the insurance company and yourself, but again, it is a third-party external reviewing entity. All right, I have given you all a lot of information. So I'll just kind of summarize what the high points of what we hit. Again, you want to shop very carefully for health insurance and do your research. Read the fine print, see what's covered, see what doctors are in and out of network. You want to understand the key terms used in health insurance. And if you have questions, healthcare.gov is a great resource. You can use your own state division or departments of insurance. Use in-network providers. That's one thing we run into a lot here in Colorado is in-network versus out-of-network providers. Do the homework, check with your provider, make sure with your carrier that they're in network before you receive care. You can, if you have PPO benefits, you can go out of network. But again, one thing that we do see a lot, and we like to talk to consumers about, is you can often use an out-of-network provider if you can show that it's medically necessary for you to do so, and there's no other providers in the state. So, there are always options, but it gets more and more complex as you move in that direction. So again, use your divisions and departments of insurance as resources. There are appeal rights in your policy. Do not be afraid to use them. They're there for a reason. You're always entitled to a second opinion if you do get a denial of coverage or a denial of a prior approval. Use our expertise. That's why we come to work each day. We love helping consumers. We love providing good customer service and helping however we can. Use our expertise, use our oversight, use us as a resource. If you have any questions or any issues obtaining coverage for a procedure or appealing a denial, and ultimately we're here to help. We love helping Colorado consumers. We love helping consumers in each and every state, where state regulators are located. That's our purpose. That's what gets us out of bed in the morning. So that I know I've said a lot about insurance. I know it's a lot of information, but yeah. And then for our very last slide, I just want to give you all a big thanks for your attention. I know it's a lot of information. I appreciate your time and look forward to the Q&A after the next segment of our presentation today. So with that, I will turn it happily back to Stephanie.
Matt, thank you. That was really incredible and so much wonderful information. I know we have some questions that are coming from the audience, and we'll get to those in a few minutes. And if you haven't submitted your question yet, now's the time. You can type your questions directly into the live chat of this YouTube or Facebook broadcast. But before we get to the Q&A, I would like to introduce you to a mom from the myFace community. Robin and her husband, Alan, are the proud parents of twins, Betsy and Alana, who were both born with clefts in 2002. The twins will be 19 years old this month. This family has been on an incredible journey with many ups and downs, but in the face of it all, they have persevered. And now Robin would like to share a bit of her story with you this evening. Welcome, Robin.
Thank you so much for having me, Stephanie. I appreciate it. So I want you to know that dealing with the insurance was actually more challenging than the surgeries that my girls had. So that's how difficult it can be for parents. The initial surgery that my girls had, I researched the experience of the doctors in network. I actually had a PPO at that time, and I still have one. And I found that we needed to go out of network for and obtain an out of network exception for the surgery. So this required a lot of research, really providing what the doctor in network was able, what his experience was with clefts, which was not much. And then I wrote this in a letter. It was a long time ago, but I know it was denied. Everything I've ever done was denied initially, probably a second time, and I've always appealed it. Appeals, use them. That's so important to get what you want. And then a few years later, my daughter needed adenoid surgery. Again, I went into in-network. I looked at the doctor. I actually took my daughter there to see the doctor, and I asked him some very pointed questions after doing a lot of research about what his capability was. And he said he didn't want to do her surgery. He knew that it was more complicated than the average adenoid. And I asked him to call the insurance company and tell them that he did not want to do it. So he did. He was very nice. And so again, I finally received approval to have an out-of-network exception for that doctor. Moving on, then I needed, my daughter had a feeding disorder, which was not covered at all. What I did was I tried a lot of outpatient services in New York. I made a list of them. I ended up writing them up after they were attempted and failed. And then I went to the insurance company with a program that I wanted to go to, which was actually inpatient in another state. Of course, it was denied, appealed again. And I actually got the name of the medical director, actually called right into the insurance company. I really needed it. I really needed this to be approved. So nothing was going to stop me. And it was approved. It was a lot of money, and it was approved in the end. Then moving on to dental treatment. I actually had my girls' dental treatment since they were born, or since they started receiving it, approved as medical. So this was, again, it was an exception, and I had to write letters. I had to have some input from the providers that I was going to use, write letters why this was medical. It wasn't cosmetic, but it was functional. And it required a lot of detail in the letters to prove the point. Again, it's denied, appealed, denied, and appealed again. What I've found that is critical is that I've always taken ownership for the letters. I would send them out to the insurance company, certified mail. Now I might even do FedEx or whatever I could do, but certified mail, so they couldn't tell me they didn't get the letter. And I also would follow up frequently to the insurance company with, and they always exceeded the time that it was supposed to take. But I would write down the dates, who I spoke to, call again, the dates and who I spoke to. The case manager was very important, to try to have a case manager. I think they're a little better now. A lot of times they said they didn't deal with claims, but I think if you get the right case manager, they can assist you in getting at least to the medical director, so the right medical director can take a look at it. A lot of times the case managers don't even understand what the surgery is about and what's going to happen, and they can't really understand it. And even the medical directors at the insurance companies are not, they'll have medical directors that are pediatricians looking at something so unusual and specific that they don't have any understanding of it. So again, it's going to have to be appealed, and you might even have to use a journal article or some kind of technical research so that the insurance company knows that you're serious about what you're asking for and that you do have an understanding of what needs to be done. I also think what I've used when the girls were little, I've called human resources in the company, and they were helpful. They helped me get the information to the right person at the insurance company. So that's what I did. And also copy a local congressman. They can help you. They don't want to see the insurance companies winning over patients. So those are my suggestions. Thank you very much, Stephanie, for having me.
Thank you so much, Robin. I really appreciate you sharing this information. So let's go into the Q&A. I know we have a lot of questions from the audience, and if you'd like to submit a question, you can do that in the live chat. But I'll start with Matt. I have a question. As young adults with craniofacial conditions age out of their parents' health insurance policies, what, in your view, is the most important question they should be asking prospective insurance providers?
Thank you, Stephanie. That's a great question. What I would recommend, and what we'd recommend to most consumers, is again to look very carefully at what is covered, what the benefits are in the plan, and kind of think about what sort of ongoing care they may need. I know it's a big deal under the ACA. You know, the children can stay on their parents' plans through age 26 and be covered then, but you know, branching out on their own and buying insurance for the first time on their own can be challenging and daunting. But I think they really need to look at if they have any physicians that they are working with for ongoing care to make sure that they're in network, see if, you know, the premium and the co-payments and deductibles can all meet their budgetary needs. Because we know a lot of people do shop on price, but if you have ongoing care concerns or ongoing care routines that you're going through, I think probably the most important thing is to look to make sure that your physicians that are a part of your care team are in network on your plan.
Great. Thank you so much, Matt. Robin, I'd like to go to you with a question. You talked about this a little bit, and Matt mentioned this in his slides. Talk a little bit more about working with your medical team and why that's important and how they've been able to help you in supporting insurance issues.
Well, they actually have the detailed knowledge and can provide medical lingo so that they can really speak to the issue. So I've had them provide a lot of the issues. I've used the dentist. I've used a few providers to help write a letter, craft a letter, and then I would send it off after they finished writing it. So that's really important because they can use medical research studies they've done, anything they've done, anything they have access to, they can provide the patient with, and you can send that along.
That's great advice. Thank you, Robin. So following up a little bit on that, Matt, you mentioned this somewhat in your presentation. Orthodontics. Are orthodontics covered under dental or medical? Your thoughts on medical insurance covering things like palate expanders and braces, or does it only cover oral surgery? I mean, this is very complicated. Do you have any thoughts on that?
I always have lots of thoughts. You know that, Stephanie. The thoughts I have, though, are the key thing, and Robin touched on this a little bit too, is medical necessity. That's really the big thing, is that if something is medically necessary, you know, a lot of people say, you know, it's that differentiation between cosmetic versus medically necessary. You know, a lot of arguments are made, you know, braces, orthodontia, a lot of times it's not actually medically necessary, it's cosmetic. So again, working with your care team, working with your physicians, your dentists, your oral surgeons, as Robin did, she pulled in the expertise of a whole team of people to get a great outcome. That would be something similar to do, is if it's medically necessary, make the case, and then the medical plan should cover it. But read the fine print. A lot of times they will put exclusions or clauses in there that talk about it. So again, make sure that you read very closely to see if that covers medically necessary orthodontic care.
Okay, great. Thank you, Matt. And I think building upon that, you mentioned medically necessary. A question about reconstructive versus cosmetic surgery. And it's very important, the language that's used and used with your medical team. Why is this? Can you speak to that a little bit?
Sure, I'd be happy to. Again, the key phrase that, you know, and I feel like a broken record, but it's true, medically necessary. Reconstructive surgery, if it's medically necessary, is not cosmetic. Again, your physicians know whether it is or not. But that, again, the terminology is very important. And the case has to be made that there is a medical reason behind this. Will it lead to future complications if it's not done? Will it cause issues with, jaw, later jaw conditions or damage to the nerves or the bone structure? The case has to be made. A strong case has to be made for the medical necessity of something being done. It's very hard to deny something as cosmetic if a strong case is made that it is medically necessary.
That's great advice. Thank you. I have a question. If I have a federal plan as a public school employee, do I have options other than solely HMO versus PPO?
That's an excellent question. I can wade gingerly into the federal area a little bit since we don't get involved with them, but probably not. I mean, the two main types of plans out there are HMO versus PPO. It just depends on who offers them. The federal employee plans, are regulated at the federal level. You can definitely check with your HR departments to see what different options you have. I know I have friends in Colorado that are teachers, and they're covered under the state employee plan. So it's very similar. So in Colorado, as a state employee, we have access to a PPO plan and an HMO plan because those are the two most commonly offered types of plans out there in the marketplace.
Great, thank you. Another question has come in. As an older adult, dental care is not covered at all, and insurance companies think it's elective when you need surgery. It's very hard to find, as an adult, craniofacial experts that work with adults. Thoughts on that, Matt?
So Patricia brought up a very important point about dental coverage. The Affordable Care Act mandates that pediatric dental coverage be included or obtained by everyone, but there's no corresponding mandate for adult dental coverage. We can all choose whether or not we want to have dental coverage ourselves. So it is a very good question, but again, if it's something that you need to have done that is medically necessary, again, it's something that work with the care team, make the case, loop in your division or Department of Insurance to help with that, to see if you can have those procedures covered as medically necessary. As far as finding providers that are able to do it, I know we here in Colorado struggle a lot of times with finding specialists and providers like that. But that, again, as Robin discussed, getting a gap exception to go out of network. Again, you can also work with your insurance companies if there are no providers in your state that are able to provide the care to seek an exception and permission to go to an out-of-state provider as well. But again, work with them on that.
That's great advice. Thank you, Matt. So we have one more question, and I'm going to turn it over to Robin with this question because it's so important. And you've navigated this for 19 years. So as a parent, what is the most important tip you can give to other parents as they navigate the challenges they're going to face along the way?
I would say, again, take ownership. The people in the office that you might ask to write the letter do not have the time. They are overwhelmed with patients and patient issues. So have them write the letter. Do anything you can, though, to assist them with writing that letter. If they have the article and you have to write it, or you're capable, or you can somehow craft it, let them do it and have the doctor sign it. Mail it yourself, certified mail. Follow up constantly. Have a case manager. They can help you, and reach out to your Department of Insurance if you have a problem, and ask Human Resources. And use your Department of Insurance. But you should take ownership, because if you persevere, you will win. But it takes a lot of effort, unfortunately.
Well, thank you for that, Robin. I really appreciate it. And I want to thank Matt and Robin so much for this incredible presentation. I know we could go on and talk a great deal about the many questions that people have. And if we didn't get to your question and you'd like to ask us a question, please email us at info@myface.org, and we'll be happy to answer your question via email. We all know that craniofacial differences can impact the body and the spirit so significantly, and MyFace provides important direct services such as access to patient and family support groups, all now virtual, topic-driven workshops just like this one, and online programs that serve to educate as well as entertain. These programs offer guidance, resources, and a supportive environment for all who participate. myFace also hosts unique networking opportunities that seek to bring our community together to empower the spirit and build strength, and let families across the country know they are not alone. For more information about our programs and services we offer, please visit myface.org. At myFace, it's important that we are providing you with services you are most in need of. And I want to remind everyone that we will be sending out an email after this broadcast asking you to take a few moments to provide your feedback about this and possible future broadcasts. And we really look forward to hearing from you. Also, look out for an email to register for our next Transforming Lives webinar on August 10th, entitled Creating Building Blocks for Home, School, and Social Connections for Children with Craniofacial Diagnosis. You can also join us on July 20th at 6 p.m. Eastern for the kickoff of our virtual summer reading series with author Kelly Verinaris, reading her book, Hi, I'm Me in Kindergarten. We have also recently launched a new monthly broadcast podcast called myFace, My Story that you can find on Spotify, Apple, and Google podcast services, as well as on myFace YouTube and Facebook channels. Finally, be sure to join us on September 19th for our annual Races for Faces event. This year, we'll be hosting the event virtually, and we are so excited to see you for this program and say hi to all of our supporters. To sign up to participate and to learn more about this year's event, visit racesforfaces.org. Thank you for sharing your time with us today, and we look forward to seeing you at our next Transforming Lives webinar on August 10th. Have a wonderful evening, everyone.